She's a liar. That's what one of my classmates blurted out during a case study discussion in class. And the woman he was referring to wasn't real. She was a fictional client named Charlie, but the judgment behind his words, well, that was all too real. And unfortunately, far too common in healthcare. Hi, I'm Tamisha Campbell, Marine Corps veteran, health coach, and founder of Enhanced Black Women's Health. And I'm on a mission to help healthcare providers like you create equitable, patient-centered care that actually serves our communities, not stereotypes. And in today's video, we're going to dive into the real reason client-centered care matters and how our assumptions as providers can get in the way of doing our jobs effectively. You'll learn how to recognize bias when it shows up and shift your mindset from hero to guide and walk away with 3 strategies you can use right now to deliver more inclusive, affirming care. Now let's talk about assumptions. When my classmate called Charlie, our fictional client, a liar because her actions didn't match her goals, it wasn't just bad form. It really reflected something much deeper. A common tendency in healthcare is to label patients as dishonest, non-compliant, or lazy when they're really just being humans. And that's not just theoretical, I've lived this. When I first sought care for my autoimmune symptoms, my provider, without asking deeper questions, focused on my BMI. Even though I quote-unquote looked fit, her advice was to eat more salads and lose weight. 3 years later, I was finally diagnosed with rheumatoid arthritis and Sjogren's syndrome, a diagnosis that could have come sooner if she had chosen to listen rather than assume. That's why I'm sharing 3 ways to be more client-centered as a provider. Number 1, don't make assumptions. We are not our clients. Your experience isn't their experience. And instead of projecting your beliefs, pause and ask more questions. Assumptions create distance, whereas curiosity builds connection. 2, practice active listening. Active listening isn't just hearing, it's hearing to understand. If my doctor had taken a little bit more time to listen to me, not just my chart, maybe she would have seen the bigger picture and saved me years of pain and frustration. And 3, be the guide, not the hero. One of my favorite takeaways from Donald Miller's book, Building a Story Brand, is this. You're not the hero, your client is. Our goal is to guide, to support, and to center their goals, not override them. Whether it's Charlie wanting to hike with her husband or a patient managing chronic pain, they get to decide success. We just help them get there. If this message resonated with you and you want to keep learning how to challenge your bias and deliver truly client-centered care, make sure you subscribe to the Enhanced Black Women's Health YouTube channel and join the EBWH community to get access to our free masterclasses and resources. So let's create care that heals without harm, and I'll see you in the next video.